This is Patrick Penny. He's a gentleman with Parkinson's disease. He's also a pretty famous, well-known voice actor.
Yeah, I was in the Terminator.
And he's still very animated and has a great sense of humor. You can notice his right hand shakes quite a bit.
Are we ready?
The other prominent motor symptom he has is rigidity and bradykinesia, which means stiffness and slowness. If he's not taking his medication, his whole body, especially the right side, becomes quite stiff.
I couldn't button my shirt. I couldn't shave.
Stan is somebody who has been suffering from tremor for most of his life.
I love to write. I can no longer write.
And he came from Alabama to come to UCSF to get treatment.
People can have a variety of movement disorders that can manifest as tremor.
That includes things like Parkinson's disease, Tourette's syndrome, and essential tremor.
It's like a monster that you can't get rid of, and that impacts everything you do.
We forget things that we just take for granted. Walking normally, eating, things that are totally automatic. When you don't have the ability to do those the same way, it's a very profound impact on your life.
There's something I can't do at all. Hold this cup in my right hand. Is there beer in there? Use the other hand.
People say, let's go to lunch. You say, yeah, I'd love to go to lunch with you. Guess what? That'd be the most embarrassing thing in the world. And so you isolate yourself, and that's not good.
That looks reasonable. There are two types of surgical treatments for movement disorders. One is called Deep Brain Stimulation, or DBS for short. DBS involves implanting a very thin, flexible wire into the center of the brain called the basal ganglia. And then the brain electrode is connected to wires that run down the neck to a small battery, kind of pacemaker that's in the chest. For Patrick, the most debilitating symptom was a tremor. And the second thing he wanted to address is the fluctuation of the medication. They can get these kind of peaks and valleys. Today, Tracy, who programmed Patrick, is going to turn on stimulation for Mr. Penny's GPI.
On my computer, I can turn on the electricity that's going to be coming out of the lead that's in a very precise part of the brain that modulates networks that are involved with causing movement disorders. All right, go ahead and get comfortable. I'm going to push the button here. Like your tremor's a little more relaxed. The key is to try to send the electricity into the areas where the brain cells are, let's say, misbehaving the most. Oh, that's good.
You know it?
A little more.
Yeah, he had it for a second, but
Yep.
he lost it.
The electricity is going to modulate those areas and help the symptoms, kind of like a cardiac pacemaker would work. We say it takes about 3 to 6 months to really get the deep brain stimulator optimized.
What's super cool is that we can shape the stimulation according to his own anatomy. So we can, shift stimulation to areas that will give him improvement in his Parkinson's symptoms.
The stimulation's going to turn back up. There you go.
There it is. It's dead. Oh, yeah.
Even though I've been doing this for 21 years, it's still very profound for me every time I see it. Okay.
That's good.
It can be life-changing.
Let me see this again.
DBS is going to give you more functionality, helping to reduce the reliance on medications over the years, and just helping speed of movement and mobility.
The other treatment is high-intensity focused ultrasound, or HIFU. HIFU is a way to lesion the brain using high-frequency energy, sound waves.
And those ultrasound waves are generated by little ultrasound emitters. And you can think about each of those emitters as being kind of like a beam of light. We take those beams and we focus them to a point in the brain to heat the tissue up.
Okay, ready for the moment of truth? Hold it up. Perfect. Touch my finger, nose. Fantastic. Much better than before. We have the before and after. I'm going to show you. It's our pleasure. Absolute pleasure. In terms of efficacy, the 5-year durability is about 70% tremor reduction at 5 years. And the effect may last much longer than that.
There's probably a handful of centers around the country that are using this kind of approach, but a lot of us now feel that we can do better. We really feel that the advanced imaging is important to really personalize the treatment in each individual patient's brain.
Oh, that's great.
To get the best clinical outcome while minimizing any risk of side effects. If you're deciding between DBS and HIFU, the advantage of deep brain stimulation being that over time you can adjust the stimulation parameters.
We also give part of control back. Patients themselves have a remote control literally into their own brain, and they can switch between the different programs depending on what they're doing. With focused ultrasound, it is irreversible. But the advantages are that it's incisionless and it's complete outpatient procedure. We have patients leave our facility, within 30 minutes to an hour after they finish treatment. Seeing all these patients who've been suffering for decades, not able to drink without spilling.
The beers will be out of danger.
And now being able to write beautiful handwritten letters, paint beautiful paintings, and just having their life back.
I'll give you a hug.
Oh, yay, okay.
That's been the most rewarding aspect of the job.
I haven't been able to eat soup in 10 years. I ordered me a bowl of clam chowder. Loved it, enjoyed it, didn't spill any of it. So you know what? Little things like that are really what life is made of.